stabilize the shoulder. So if you have strong rotator cuff muscles, then the likelihood of dislocating your shoulder will go down. Okay, so shoulder impingement. So the supraspinatus tendon, the subacromial bursa, and the long head biceps tendon all pass under the portico-acromial arch. And there's not a ton of space there, and so if you overuse it a lot, then it will pinch those three, and that's what impingement is. It's pain when you are like flexing your shoulder because those three things are pinched. And so a way to fix that is to strengthen your rotator cuff muscles or modify activity so you're not like doing a ton of arm raising. I'd imagine that a lot of basketball players get shoulder impingement. Yeah, so know those three things that are, or those three structures that are associated with impingement and why it happens. Yeah, and then so this is specifically the long head of the biceps tendon. The short head, I believe, like inserts over here, but the long head goes all the way and then inserts over there. And this is the supraspinatus tendon and the bursa. Is the blue thing. Okay, rotator cuff tear. It can happen in any of the muscles, but it's most common in the supraspinatus. And that probably has to do with it being pinched in that small area. And you can have a partial or complete tear, but a complete tear is most often with older athletes, so people who have been using it for a really long time. And then to manage a rotator cuff tear, you can do physical therapy or get surgery. E-stim helps with pain. Thoracic outlet syndrome is compression of the brachial plexus, the artery and vein that are all running like through here, and it causes muscle atrophy, and you help by stretching and strengthening exercises.
Sorry, just a clarification. Does it cause muscle atrophy or is it caused by muscle atrophy?
I think it causes muscle atrophy.
Okay.
Yeah, and you'll feel a lot of pain in the brachial plexus. Okay, and then bicipital tenosynovitis. So it's tendinopathy of the biceps, and it's caused by repetitive stretching of the biceps, which leads to inflammation. So this is like with pain while flexing, and then to manage it, rest, strengthen the biceps, and eccentric loading. Okay, so the elbow. So you have the humeral ulnar joint and the radial ulnar joint. So the humeral ulnar is between the humerus and the ulna, and then radial ulnar is radius and the ulna. Then you have the ligaments. Ulnar collateral and medial collateral are the same thing. Radial collateral and lateral collateral are the same thing. And then you have the annular ligament, which holds the radial head in the groove. It like wraps around the head of the radius. And so no, we talked about this with bone, how like spongy and trabecular is the same thing. So if an answer has ulnar and medial collateral ligaments, you know that it's probably not that answer because those are the same thing. And radial and lateral, same thing. So you can rule those out. And then the muscles, you have the flexors, which originate on the medial epicondyle, and then the extensors, which originate on the lateral epicondyle, and then pronators and supinators. So you don't have to know origins and insertions for this class, but know that the flexors originate on the medial epicondyle, and the extensors originate on the lateral epicondyle, the lateral side of the arm. Okay, injury. So bursitis again is inflammation of the bursa. We have ligament sprains. So MCL ligament sprain is the most common, and it happens a lot in baseball players. So if a question has to do with a baseball player, you know that it's the MCL ligament of the elbow, not the leg. So it's because when they stretch their arm to throw a pitch, then the medial collateral ligament is has a lot of strain put on it over and over again. And then the Tommy John surgery, did he explain what that was?
Yeah, basically.
Just know that. You don't have to know in depth what it is, but just know that it's associated with the MCL sprain. And then LCL sprain is not as common. That's pretty much all you have to know about that. And then the other thing is epicondylitis. So that's an overuse injury. So medial epicondylitis is due to elbow flexion, like overuse of your flexors, and that's like golf elbow, pitcher's elbow, related to MCL sprains. And then lateral is going to be elbow extension and supination. So tennis elbow, because they're backhand, so they're always extending. So they tend to get inflammation in the lateral side of their arm. And eccentric training helps strengthen the flexors and extensors. So it will reduce the risk of the overuse injury. Okay, and then more injuries. So you're gonna have elbow dislocations. It can pop out in any direction. And they're really bad. And you need a splint and transport, right? So you need to get it reduced. And they're bad because they lead to ulnar nerve injuries. So it's important that you're careful with your elbow, because right here you have the ulnar nerve sulcus, and your ulnar nerve comes and it runs right through there, and it's pretty superficial. And so if you hit that, then you can have an ulnar nerve injury. It's like your funny bone when you hit it and your arm starts tingling. So if it's like really severe, then you could have like permanent tingling or numbness. Yeah. So that's why dislocations are really bad, because they lead to ulnar nerve injuries. Okay, modalities. So a modality is any technique or device that can aid in the healing process. And we talk about a lot of modalities. So cryotherapy is ice. The most important thing you need to remember is that it reduces pain. Ice reduces pain. And the time is about 10 to 45 minutes. So it's longer than you can apply heat. You have to apply heat for less time. So thermotherapy is
Do you have
heat.
to know anything about the depth that it gets to? So 2 to 3 centimeters for heat and ice.
Okay, so thermotherapy is heat, and it increases blood flow, decreases pain, and then you're gonna apply this, like pads and stuff. It's gonna be less, 10 to 25 minutes, because you don't want to overheat the body.
Do we need to keep in mind, like, not to use heat with if someone has a circulation problem? He like mentioned that like a couple times in class, so it's kind of like important or not.
Sure. It's good to remember. Don't use heat if someone has circulation problems. Just know all information. Okay, so ultrasound, electromagnetic waves, stimulate soft tissue repair. Those are like the main points you need to remember about ultrasounds. Electrotherapy is like electricity, so electrical stimulation, it helps with muscle contraction, which helps with muscle strengthening stuff. So people who have ACL injuries often will have E-stims, so they can learn to contract things.
Did he say that that's just increased heat? Is that right? Is that what he stands for? Just
Yeah, E-stim helps with pain, but it also helps your muscle learn how to contract. Yeah.
Wait, are you sure ultrasound is electromagnetic waves?
It's sound wave.
Isn't it compression waves?
Has to do with electromagnetic waves.
Because sound is compression waves, light is electromagnetic waves. Because diathermy is electromagnetic.
Well, I'm not 100% sure, but that's what he said.
And remember, he's always right.
Okay, and then he also talked about massage. So massage is the best therapy. And it encourages tissue regeneration through mechanical force, helps increase circulation, and it's very relaxing. It will help your muscles relax. It can also direct like extra fluid, help fluid accumulation in the nose. Okay, so this is the article that you guys read on modalities. These are like the main points that I thought were important. The definition of knowledgeology is the study of application without theory. So it's essentially wanting to know the what without the why. So just so you can treat people, but you don't really know why you're treating them that way. There are 4 things that help make action plans, and that's tradition, experience, research, and theory. So tradition is like what has always been done, what has worked. Experience, like you've experienced that it's worked. Research, obviously that, and then theory, kind of self-explanatory. So it said that it's important to have a combination of research, but positive clinical trials are the best. And so I think there was a study that you read that said like, it talked about the effect of NSAIDs, and it said that like, we think that this is the effect of NSAIDs, but there's no randomized clinical trials that prove this. So it's important to have the research, but also clinical trials are the best kind of research to have. And then 5 things work together to decide which modality to use. Know these 5 things: correct diagnosis of the injury, knowledge of changes associated with the injury, an outline of an overall treatment plan, understanding of modality effects, and then you need to match goals with the modality so that you can choose the modality to use for the injury.
Positive clinical trials opposed to negative clinical trials, does that mean that the positive clinical trials work and the negative ones don't?
Yes.
Okay. Just verbiage.
Okay, and then this is the last section, so rehabilitation. So we have the cookbook versus problem-solving approach. So what's the cookbook method?
Step by step. Without giving care and overuse.
Yeah,
Same all the time.
Treat them all the same.
yeah, treat them all the same, right? So it's just like a recipe, just step by step. You're not really taking into account the situation. And then problem-solving approach is like specifically looking at their injury, how they got it, and how you can fix it. And then the goal of rehabilitation is to reduce re-injury. So it's not like that they will, I don't know, have more strength than they did before, or they will be able to return to their sport. It's that they will reduce the risk of re-injury. So there's 8 goals we talked about in class: to control pain, control edema, to restore range of motion, strength, endurance, power, neuromuscular control, and then gear towards sport-specific skills. So it kind of goes in order. So to control pain, you're going to use modalities, and then rest, ice, compression, elevation, and then P, protection. Protection comes first, equals price. So just know what, like, the acronym. So what's the modality that helps the most with pain?
Yes.
Yes, ice, and then he still also helps, but ice is mostly. Okay, so edema, massage helps, like I said, it will redirect fluids. Range of motion, so you're gonna go from passive range of motion to active range of motion exercises to resistance exercises. So what's passive range of motion?
Somebody or something helping you.
Yeah, so someone or something is helping you move. Active, yeah, you're moving it, and then if you have resistance, something is resisting you, right? So you're adding a little bit of strength in there. Okay, strength. So mostly this is used early to prevent atrophy of muscles, and you're gonna do isometric. So when they have a muscle injury but they don't have their range of motion restored, they're gonna use isometric exercises, which is contraction without range of motion. So this helps improve strength without like causing pain from range of motion. So it's used early to prevent atrophy. You work from lower to higher weights, and then use closed chain exercises, which helps with resistance.
What was the closed chain exercises again?
So that's like when you're like attached to something, you have like you have like something wrapped around your ankle, and you're like attached to a wall or something pulling back.
Isn't closed chain a part of it? Yeah, the distal
Closed chain is
portion
like
is
squats.
set on the, like,
It's just attached to something that's on the floor or wall.
Or like if you have like things around your legs, you do a squat.
Yeah, because that's like the example of closed chain is like a squat.
Yeah, closed chain is like squat, and open chain is like leg extensions.
so if you did like a single leg squat, that would be an open chain because you have, wouldn't that be?
That'd
Or
be
would that
closed
still be
chain.
closed chain
Still be
because
closed
the
chain.
distal?
Closed.
Yeah. Anytime the distal segment is like on the ground or
Yeah.
set in some place.
don't have to know like super in depth, but just know those gym exercises help with strength. Okay, and then to restore endurance, so this is going to be conditioning, and it's going to be specific to the injury, so it's going to be different for every injury. There's not much to know. So to restore power, so power is force and time. So it's how quickly something can be performed, and this is better than strength. So muscle power is better than muscle strength. Okay, and then to help with neuromuscular control, you restore proprioception, kinesthesia, balance. We talked about that in class. So kinesthesia is movement. Being able to move. Proprioception is like your awareness of where you are. And then the last is to restore sport-specific skills. It's pretty much self-explanatory. Nothing to go over there. And then 3 questions to ask when using the problem-solving approach are: what tissues are damaged and how do they heal? What secondary problems are typical and how can I assess them? And then how can I intervene? So he went through the ankle example, and you don't have to know that, like, you don't have to know anything about that, but know this. So know how to apply this. So if he gave you, like, okay, you injured the ankle, you say, okay, I need to ask what tissues are damaged and how they heal. I need to see what secondary problems are typical, and then how can I intervene? So what modalities can I use, and how can I help in the healing process?
With the goals of rehabilitation, I don't remember, did you mention like a ninth one that had to do with like overcompensation?
That was like his own. That was like one that he would add.
Yeah, maybe know that. I don't know.
Okay.
I just looked on his slides.
Okay.
There's one that she like said, I don't think she's still on the slides, but it's like
compensatory mechanisms.
What was it?
Correcting compensatory mechanisms.
Correcting compensatory mechanisms.
Oh, that's it. Almost question.
Yeah, sounds like it.
Okay, and that's it. So this is on Learning Suite. Do you have any other questions?
Thank you.
Awesome.